Hi, welcome back to my doctoral journey. My name is Kalia McShann. I wanted to thank everybody that comment on whether it's LinkedIn, Facebook, or YouTube in regards to the topic of discussions in healthcare administration. I wanted to share with you just some insight and some things that I've been going over as far as the last topic that I discussed, which was how can leaders improve the integrity and ethical behaviors of healthcare providers during times of crisis and burnout. So, one suggestion was this particular topic can be just too wide, and it kind of narrowed it down. So I wanted to bring a topic that all healthcare industries have seen, have are going through now, whether it's a clinic or urgent care center, that impact the quality of patient care in the um, basically the atmosphere of your healthcare clinic or environment. One is um, clinicians or providers, it could be nursing staff, tech, CNAs, whoever, refusing assignments. As leaders, what do you do to help or hold people accountable, and let them see the bottom line is to care for patients? There's some suggestions that people have been pouring in, and maybe one or two that I found to be very, very essential to holding people accountable when they take the positions of being a healthcare provider on any level. Number one is reminding them of the vision, the mission, and the core values of that particular organization. Whenever you decide to join an organization or you're employed by an organization, that organization has their own code of conduct, that they feel all employees should abide by no matter what. And when you take that job, you're committing yourself to that particular mission, vision, and core value. Now, most healthcare organization goes without saying, as a provider, a healthcare professional, you're committing yourself to actually seeing and caring for that particular patient. When that is not done, it is called what? Abandoning your assignment or abandoning the patient. So how do we restore the integrity when people are burnt out, staff members are burnt out, or there are times where we see a lot that nursing management, or whether it can be any type of situation, there's always certain people that do the job without pushback. And so those people become burnt out because they're always the ones called on to do a particular assignment. We need to know strategies to help mitigate this issue so that these individuals or providers will feel a sense of relief and a sense of recognition, and also to help share the workload evenly amongst their peers. So one again, the topic is how do we hold people accountable to bring back the integrity and ethical behavior in the workplace when people are refusing their assignments. And the other one is how do um, excuse me, how do leaders restore again the integrity and ethical behaviors when there is conflict among the team? I would like for you guys to put your comments, whatever suggestions that you may have regarding these two topics, as far as bringing integrity and ethical behavior within conflict resolution, as well as staff refusing assignments. One thing I believe remains true within any healthcare organization, and that should be maybe brought as a regulatory, maybe quarterly team meeting, is to always put in front of the staff their reasons why. Why did you decide to go into healthcare? What was your purpose? Was it patient driven? Was it incentive driven? Compensation? What is the why? The why you get up every day? Why do you go into a healthcare organization, clinic, wherever it is? What makes you decide? What made you decide to choose healthcare? So put your comments in. And even if you're a patient, or if you're not in healthcare, but you, of course, we all have maybe been to the doctor. If you are one of the ones that never been to the doctor, glory be to God for that. But most of the time, we're going to either experience receiving healthcare from somebody, or we are going to be the ones providing the healthcare. Either way, wherever